Well, good morning, everyone, and thank you for being here today, and hello to everyone that's joining us over the web for this important workshop. On behalf of the U.S. Environmental Protection Agency, I'd like to welcome all of you to this workshop on the health risks of exposure to indoor particulate matter. I'm pleased to be here representing EPA's Office of Air and Radiation. That's the group that does the outdoor regulations of PM that Bill was talking about in the introduction, and in particular the Indoor Environments Division. I'm the director of that division, and our organization is the sponsor of this workshop, an effort to more comprehensively consider the health risks of indoor PM. I want to thank the full Academy, the National Academy of Medicine, and the staff, David Butler and Guru Madhavan, and all the panel participants who are here for accepting EPA's charge to examine this issue and the public health risks that it presents. And I want to thank two of my staff in particular, Laura Cobb and Greg Bruner, for their work spearheading EPA's engagement with Academy and working closely with Academy to put this review in place and prepare for this workshop and the proceedings that will come from it. The Indoor Environments Division at EPA is responsible for carrying out non-regulatory guidance, technical assistance, outreach and education programs to protect the public from harmful exposure to indoor pollutants, as opposed to the outdoor part of the air program at EPA, which primarily is works in a regulatory capacity. Our work is non-regulatory in nature. Our program major priorities at this time include, for example, radon, indoor environmental asthma triggers, secondhand smoke, mold and moisture. Our organization also addresses formaldehyde, PCBs, and other chemicals and biological contaminants found indoors. And the program, the non-regulatory program that we run in the Indoor Environments Division at EPA is focused on promoting interventions to reduce exposure to specific indoor pollutants of high concern, as well as comprehensive indoor air quality interventions in homes, schools, and other buildings. So we have targeted efforts at issues like radon and secondhand smoke and mold, but we also work to develop solutions that are holistic in nature, everywhere from the design and construction of buildings through their commissioning and operation and maintenance. And within that, particulate matter is an important source that's paid attention to in these holistic interventions. Providing information to the public on significant sources of indoor PM and how to reduce exposures then is part of our ongoing work. However, the body of literature related to indoor PM has been expanding, and last year, in 2015, our program began to examine the available knowledge on indoor PM health and PM reduction strategies and interventions. And while we have a good understanding of some health effects and some exposure information and intervention guidance for some sources of indoor PM, such as secondhand smoke and cooking, as Bill was mentioning, we think it's important to take a comprehensive look at the body of literature on indoor PM and the recent literature that's been emerging, both on the health consequences, exposure, and intervention approaches. Given the growing body of literature related to indoor PM and the fact that we already know that there are a number of PM sources indoors that present public health risks, we commissioned the Academy to examine the issue of indoor exposure to particulate matter more comprehensively and consider both the health risks and intervention strategies in this workshop format. As Dr. Nazaroff mentioned, we're also asking the Academy, as you examine indoor exposure to PM, to give particular consideration to vulnerable populations, interventions, and the risk communication and outreach as well. On behalf of EPA, I want to thank all the panel members and the Academy staff for devoting your time and expertise to this important issue. We're very grateful for this. We think this is an important public health risk. We will be using the results of this workshop to inform the work that the agency does on this issue. I'm really pleased with the breadth of the agenda for the 2 days of this workshop and the comprehensive way you'll be examining the issue. We'll carefully consider all of the discussion and analysis done as part of this effort as we plan our future guidance, outreach, and technical assistance programs and how we might best protect public health from indoor PM exposure. So we're looking forward to seeing the work that emerges from this workshop. Thank you all again for your participation. If you have any questions for Laura, Greg, and me at this time, we'd be happy to try to address those. And if not, I'll turn things back over to Dr. Nassaroff to proceed with the agenda. Very good.
Hi, this is David Butler. Thanks again for those of you who joined us a little bit late. I'd like to just take a moment to talk about the logistics of this and all of the subsequent sessions. We will be having 3 speakers per session. We'll invite them to go up to the podium, give their presentations, answer some clarifying questions that might take place during their talks. But we'd like to encourage people to reserve their questions for the discussion period at the end of each session. After all 3 speakers have had a chance to talk, we will invite them to take the seats at the very front of our room here, where we'll have a moderated discussion that will, in this particular case, be led by Professor Nassaroff. Thank you.